Welcome back. Thom Hartmann here with you. Young Americans are dying right now in record numbers by young, in particular, 25 to 34-year-olds. That's the group that is dying the most. But in general, 25 to 64-year-olds. This started in the 1980s. Right? Throughout the 1970s, death rates were going down. In the 1980s, death rates started going up very slightly, but it has really picked up recently. And what has really picked it up is, in my opinion, the Reagan Revolution. We have now reached full Reagan Revolution. In 1981, he started out destroying workers' rights, destroying unions, which, of course, as people lost union jobs, they lost health care and things like that. And this year, for the first time in generations now, the number of Americans who are, quote, middle class, that is, well, whatever that definition is, the number of Americans who are defined as middle class by our government statistics for the first time since the 1940s has dropped below 50%. We're not even a majority middle class country anymore. We're a majority poor country now. And when you look at, and this is the result of Reagan, the Reagan Revolution, changing our tax code. There have been 6 major tax cuts since Reagan's first one. And what this has done is it has transferred something on the order of $6 or $7 trillion out of the wealth of the middle class. Used to be, being middle class. I mean, back in the 60s, 70s, even the 80s, before Reaganism really sunk in, people had bought a house, they bought a car. Sometimes they had a second house or a vacation home. They took vacations. That was the American dream, being middle class. It's gone, and now we're learning from this new report, from the Journal of the American Medical Association, that for three years in a row, which I think coincides with with Republicans taking over the White House and Republicans refusing to expand Medicaid. But for 3 years in a row, death rates for young people, 25 to 54-year-olds, 25 to 34, has been exploding, while the death rate for Americans 25 to 64 years old, people in the prime of their lives, has been continuously increasing. There's an article about this in the New York Times by Gina Colada and Tabrina Tavernes. As the life expectancy of Americans has declined over a period of 3 years, the focus has been on the plight of white Americans, they write. But a new analysis that was published in the Journal of the American Medical Association yesterday said that the increased death rates among people in midlife extend to all racial groups, all ethnic groups, suburbs, and cities, even though the whole story that we've been hearing is it's poor rural white people overdosing on narcotics. No, it's not narcotics. I mean, drug overdoses certainly are a problem, along with suicides and alcoholism, which have also all been going up since we went into Reaganomics. They'd all been on a steady decline from the 30s to the 70s. And then starting in the 80s, they all started going back up again. And because, basically Reagan stepped in and said, we're going to destroy the middle class. But the leading causes of death are not just suicides, drug overdoses, and alcoholism. They're heart disease, strokes, and COPD. COPD is typically the result of smoking, heart disease and strokes, huge dietary pieces to those things. In fact, if you haven't seen this amazing new documentary over on Netflix, produced by Arnold Schwarzenegger, and it's called Game Changers. And it's just an hour-long documentary. It's short. You can watch it. It's mind-boggling. I mean, Louise and I sat there with one of our kids, just slack-jawed in amazement. And it's about the impact that diet has on your health and what the optimal diet is for human beings and all the science on it. And they showed the strongest man on earth and the fastest man on earth, all this amazing stuff. But anyhow, that's a piece of it, because our food now contains half the nutrients it did in 1950, our vegetables. This is the result of factory farming. And, our processed food is filled with chemicals that are killing us. But the side that seems to be driving this increase in mortality is that people lack access to health care. It's like this one very, very simple thing that you know, along with increased poverty. Stephen Wolfe of Virginia Commonwealth University is the lead author of this study that was published yesterday in the Journal of the American Medical Association. He said the whole country is at a health disadvantage compared to other wealthy nations. We're the only country in the world where this is happening. The only developed country, the only, quote, wealthy country in the world. And if more than half of our citizens are now poor, I'm not sure how we can even call ourselves a wealthy country any longer. We've got a bunch of billionaires. We've got more billionaires than anybody else on earth. But anyhow, he goes on to say, this is in the study's lead author, Dr. Stephen Wolfe. He says, we are losing people in the most productive period of their lives. Children are losing parents. Employers have a sicker workforce. He says, despite the fact that the United States has the highest per capita health spending in the world, that was from an editorial in the Journal of the American Medical Association. We're having this problem. Now, interestingly, and the thing that seems to point to it being access to health care, which is still not available in most red states, they note in the New York Times piece, death rates are actually improving among children and older Americans. If you're under 12 or under 18, or if you're over 65, people who are under 18 and over 65, they're actually living longer now. Why? Because if you're under 18, you qualify for Medicaid if you're poor. And if you're over 65, you qualify for Medicare. As the New York Times article notes, death rates are actually improving among children and older Americans, Dr. Wolfe noted, perhaps because they have more reliable health care, Medicaid for many children and Medicare for older people. The states with the highest relative increases in death rates among young and middle-aged adults, New Hampshire, Maine, Vermont, West Virginia, and Ohio. 5 of them red states. Fully a third of the worst death rate states are in 4 states. Red states that have not expanded Medicaid: Ohio, Pennsylvania, Kentucky, and Indiana. Now, it's possible Ohio has expanded it. I don't recall, but Dr. Wolfe says we need to look at the root causes. Something changed in the 1980s. This is the lead author of this study in the Journal of the American Medical Association, and he's saying something changed in the 1980s, which is when the growth in our life expectancy began to slow down compared to other wealthy nations. Well, gee, what happened in the 1980s? We changed our economic system and we changed our political system. We went from Keynesian economics under Franklin Roosevelt through every president right on through, including LBJ with the Great Society, and a political system where politicians answered to the people and gave the people what they want. And I think the Great Society is a great example of that. Obviously, you look at the New Deal, FDR in the 1930s, and people say, well, yeah, he did that because of the Great Depression. He had to do that. But LBJ, we had no Great Depression going on in 1960, 4, 5, 6, 7, 8. When LBJ passed the Civil Rights Act and the Voting Rights Act, and then all these great society programs, Medicare, Medicaid, food stamps, aid to families with dependent children, expanding, Title 9 or 10, whichever it is, housing, expanding housing for low-income people. I mean, Lyndon Johnson cut poverty in half in a decade in the United States with the Great Society. But 20 years later, more than half of those programs were either gone or gutted, essentially. So here is this, world-famous physician running this study published in the Journal of the American Medical Association. He says, and he doesn't understand what happened in the 1980s. He says it's a worrying pattern. He said, we used to be much more similar. What he's talking about is, region to region around the United States and poor people and wealthy people in terms of health outcomes. He says, we used to be much more similar, even when I was in college in the early 1970s. But now we're pulling apart. We haven't really explained what's gone wrong and what to do about it. Well, I can tell you what's gone wrong. Ronald Reagan, Reaganomics. Reaganomics is still the economic and political system that we are operating under. Bill Clinton declared Reaganomics. The era of big government as we know it is over. The welfare as we know it is ended. I mean, this is where we're at. Peak Reaganomics right now And it is killing off our young Americans. Not our youngest, they're covered by Medicaid, but working age Americans, 25 to 64, dying at rates that you do not see in any other developed country in the world, yet we literally pay more than twice as much per person for health care in the United States than any other country in the world. And meanwhile, Donald Trump is trying to force the Brits to privatize their National Health Service.